Hi, everybody. This is Trisha Haley. I'm here at the Administration for Children and Families DC office. Thank you so much for joining today's webinar. As is our way, this will be familiar to you if you've been on our webinars before. We're going to give folks just about 1 or 2 more minutes to join up, and then we will get started. Hi again, everybody. This is Trisha again at DC office of ACF. Just a few quick logistical announcements, and then we will get started. First of all, you have likely learned, as you so often do, that you are all muted. Not because we don't want to hear your input, it's so that we can avoid background noise. So please make good use of your chat or question box throughout the course of the webinar. We'll be watching the questions as they come in, but we are planning to address them at the end. We have a few different speakers on this webinar, so if you have a question for one of them directly, please feel free to use her name or her state or office so that we can get it directed that way. I am guessing we've got a flashing question in the question box. I'm just going to guess already that it's whether or not the slides are available. The slides are not online as of yet, but they will be. We have actually finally just crossed the barrier in terms of getting things online more quickly. So we're actually hoping that within the next week these will be online. Hopefully you got a link today with the first 2 webinars in this series, but we'll make sure that we send those out as well. So without further ado, I will hand it over one last time to the Director of the Office of Child Care, Rachel Schumacher.
And thank you, Tricia. It's been such a pleasure doing the many webinars that we've been doing together over the last couple of years. And welcome to all of you on the phone today who have come to hear about consumer education and parental choice, which was, we're gratified so many people have signed up because it really is an incredibly important aspect of the Child Care and Development Block Grant, as you all know. And everyone showing up kind of helps us realize that this is a good topic to put on. One of the reasons that we really wanted to highlight this as part of the initial series going over implementation of the rule is the prominent way in which consumer education and providing consumer education information to help parents make informed choices was revised and added to in the bipartisan reauthorization of the Child Care and Development Block Grant in 2014. Consumer education has always been in there, but now they really built on it. They talked about it in a way that I think recognizes years of work to understand how helping parents with information is really a foundation for their engagement in their children's lives, helping them to choose more high-quality child care and to feel like they are good stewards of their child's learning for the rest of really their time as parents. And so that foundation is built in early childhood and through those early years when parents really are looking for information. And that helps inform parent choice. Parent choice is so critical, a foundational piece of the Act. And it really has multiple parts. I think people can think about it in multiple ways. The information piece and the engagement and having a place to turn for information that they rely on, that parents can rely on, is really critical. And Megan Campbell is going to walk you through that in a moment. I just want to leave you with, you know, survey after survey shows that parents want high quality for their children, and a recent one from the Robert Wood Johnson Foundation and in collaboration with the Harvard Chan School of Public Health once again showed that parents want quality child care, they know child care is important, and they value child care as improving not only their child's development, but their own ability to parent. And they really rely on those folks too. So that's one of the things that we will talk about in a moment, the wisdom of Congress to add parents, general public, and providers as key locations and opportunities for parents to access information that we really hope that folks on the line are thinking about creative ways of doing this and recognizing that consumer education is a stepping stone to the full parental and family engagement, and which we know is so critical for child development and the future of our children and families and our communities. So without further ado, I will hand it over to Megan, who will walk you through all this.
Thank you, Rachel, and I'm happy that you could do your last webinar with us for consumer ed, because I feel like it's very fitting. And thank you everybody for joining. It's really exciting to see the turnout. I have been working on the consumer ed parts of the old rule and the law and the new rule for several years, so I think it's a really exciting topic, and I'm really excited for our state presenters. We have Carrie Phillips from Utah and Deb Swenson-Klatt from Minnesota, and they've both done really great things with their websites and other consumer ed to make sure that their families have the information they need. So I am going to go rather quickly through the requirements of the law, of the rule, and all this information will be on the website. A lot of it is already there because it's from other presentations, and then we'll get to the more interesting part of this, which is the states, and for you all to learn from each other. So I guess moving on. Very quickly, you may have heard the CCDBG was reauthorized in 2014. And we continue to build off of that, and it continues 2 years later to still feel like quite a change for all of us. And so I'm excited that we get to keep presenting and training and learning about the law. And again, the effective date, we've shared these before, but just to be clear, the effective date of the rule was 60 days after its publication, but the compliance date for all of the components, especially the new pieces that were added in the rule outside of the law, they'll be determined by September 30th, 2018 through your CCDF plans and federal monitoring. And then for the tribes, there's an additional year, so that compliance will be effective October 1st, 2019. And then, as you know, we've been approaching the trainings and the look at the rule and the law based on these 4 buckets. And so today we will be looking at how to help parents make informed consumer choices and access information to support child development. All right. And as Rachel mentioned, consumer education plays a really critical role in supporting parental choice, which is a long-standing purpose and goal of the CCDF program. The second purpose in the law is to promote parental choice, to empower working parents to make their own decisions. But without the information they need, that parental choice is not very meaningful. It's hard for parents to tell the difference between a lot of different providers, and especially if they're trying to make sure that their child is in a safe and enriching environment. They need more information to make those choices real and ensure that what we're providing in the program is meaningful. So a few of the topics, and we'll go into this more in detail, but some of the requirements to help support the parental choice piece of consumer education include providing more information about health and safety records, a searchable list of providers, and also a consumer statement that we've targeted at our CCDF parents. And also, as Rachel said, the new law and the rule went further than it used to when it came to the role of consumer education in the program. And as part of the consumer education purpose of the law, Congress did add a second piece that its goal is also to promote involvement by parents and family members in the development of their children and in childcare settings. And so all of the consumer education pieces are an opportunity to engage with families, to help them learn more about their own child's development, as well as the providers with whom they're working. And so we're going to, though this webinar technically focuses on parental choice and consumer education, I don't want us to forget the importance that this all plays in the role with family engagement. So just to keep that in the back of your mind as we're going through these topics. And just a couple other areas where family engagement has pops up in the law and the rule. Also, we require the consumer education to include information about meaningful parent and family engagement. And then also, one of the quality activities that's allowable is supporting professional development. And the law specifically says that funds can be used to provide training and outreach on engaging parents and families in culturally and linguistically appropriate ways as part of those professional development activities. Okay. So real quick, here are the regulatory references. And if you're interested in looking at the preamble, which I think hopefully provides some good explanation, it's subpart D. That's where these pieces fall into the rule. And we also, whenever we cite things, we try to cite what page from the preamble as well when you see FAQs online. All right. So the big, as you know, the first big, I think, component that we look at when we look at the consumer education is the consumer education website that the states need to create to provide information to families. So in the law, it requires states and territories to make certain information available electronically. And what we did with the final rule was we collapsed that with some other requirements in the law that talked about a website and put it all together into a single website. And it must include certain components that are available to parents, providers, and the general public. And the components must be consumer friendly and easily accessible. And the website must ensure access, the widest possible access to services for families who speak languages other than English and persons with disabilities. And one thing about making the website accessible is many states already have guidelines for this, which is why we chose not to add our new requirements, part of the law, to keep state flexibility. So when you're looking at putting together your websites or re-envisioning your websites, I think that that's something to look at where your state policies already lie. As part of the, in the law and then in the preamble, we've laid out a few key requirements that help make it more accessible. And this includes that the materials be in plain language and consider the abilities, languages, and literacy levels of the targeted audience. We also encourage translating materials into multiple languages, as well as informing persons with disabilities how they can access auxiliary aids or services and receive information in alternative forms for no cost. We don't want additional information to be a barrier for anybody. All right, and this is the big table with all the pieces of the website coming together into one thing. So I'm going to go through this, and then I'll talk a little bit more in detail about a couple of the components. But feel free to always ask questions about anything that I go through too quickly. So the first requirement of the consumer education website is for state policies and procedures, including the process for licensing of providers, monitoring and inspections of providers, and background check requirements, including the offenses that would prevent an individual from becoming a child care provider. The second piece are the provider-specific information areas, and this includes a localized list of child care providers with licensing status that must be searchable by zip code, the quality of a child care provider if it's available for that provider, and the results of monitoring and inspection reports. I'm going to provide more information about the monitoring and inspection reports in a minute. I know that's an area where we get a lot of questions, so I'm not trying to skip through it now. I just want to get to the other components first. The website must also include the annual number of deaths, serious injuries, and instances of substantiated child abuse in child care settings. And the final rule clarifies that the data on deaths and serious injuries must be broken down by provider category and licensing status. The website must also include information on how to make referrals to local child care resource and referral agencies. And then lastly, it must provide directions on how parents can contact the lead agency or a designee for help understanding the website, Web-based information systems are really helpful. As a person who doesn't like talking on the phone much, I prefer very well done websites where I can just learn everything I need. But sometimes it's hard to understand what is there, and so we really want to make sure that parents can quickly access a resource to better understand that information as they are working through a lot of information that will be included on the website. All right. Sorry. Okay. So the monitoring and inspection reports. The states and territories must post reports for any provider that is subject to CCDF monitoring requirements, as well as all licensed child care providers and all child care providers eligible to deliver CCDF services. Relative to care for only children, people who care for only children to whom they are related may be exempted, which is the same with other health and safety requirements. Reports must also use plain language that parents and child care providers and caregivers can understand. Reports that include complicated references and lack explanation are not consumer friendly, which is required by the law and the final rule. And they limit a parent's ability to make an informed decision about a child care provider, and that hurts the parents of their choices. If the full report is not in plain language, we recognize that for a lot of people, that's a big leap from where your licensing reports are now, or your inspection, not just licensing, excuse me. If they're not currently in plain language, you must post a plain language summary or interpretation in addition to the full monitoring and inspection report. And when we say full report, we mean full report. You need to post the full thing, and then a summary can go along with it if the full one is not consumer in plain language. But we do encourage you to think about simplifying and translating your reports, and then hopefully as we move forward with more plain language reports themselves, the summary will not be as necessary. Lead agencies must also post at a minimum 3 years of results where they're available. And I should say we don't expect lead agencies to post reports from prior to the effective date of this provision. And the monitoring and inspection reports do have a statutory deadline that's different than a lot of the rule and the law. And those must all be posted by November 19th, 2017, which is the 3rd anniversary of the passing of the law. So it would be 3 years from that date. So if you have back ones and want to share them with the public, that would be great. And then lastly, posting results in a timely manner is important to make sure that parents have the information they need to make informed decisions. We're leaving it to your discretion as to what timely means and to determine a reasonable amount of time, but we recommend, but do not require, that the results be posted no later than 90 days after the inspection. Okay. So there are a few components of the actual reports that the rule requires, excuse me. The first is the date of the last inspection, and then any information on corrective actions that have been taken by the state or the child care provider where that's applicable. Reports must also prominently display any health and safety violations, which include any fatalities or serious injuries that occurred at that child care provider. It's really important for parents to be able to clearly identify if a provider has had a really serious health and safety violation, especially if it's led to the death of a child or a serious injury. We recommend the information be the first item on the report, maybe highlighted in a box. It's up to states how they choose to do this, but that's one option we suggest. And then lastly, the lead agencies must establish a process for correcting inaccuracies in the report. And we encourage you, many states already have this, but we encourage you to especially to work with provider groups when coming up with this process to make sure that it's supported on both ends. Okay. So those are all the components of the required components of the required website. They all must be on the website. However, there's a whole other set of consumer education requirements that Congress did not require to be provided electronically, and so therefore we are not requiring it to be on the website. However, you can certainly put this on the website. We encourage you to do it, but there's also other ways to provide this information. It can be through child care resource and referral agencies, providing information to parents through direct conversations with caseworkers, information sessions for parents and child care providers, outreach and counseling that can be available at intake from eligibility workers, and also, and very strongly, a very important resource for parents are their providers. So making sure that providers understand this information and can provide the information to their parents is also critical. So I'm going to go through these quickly because, but we do have this information, like I said, on the website on our reauthorization page, and so you can get more detail there. So the final rule requires states to provide information through the CCR&Rs or other means, as I mentioned, about the availability of child care services through CCDF and other early childhood programs for which the families might be eligible and how they can obtain that assistance. Information about other programs for which families receiving CCDF may be eligible, such as TANF and SNAP. Programs carried out under Section 619 and Part C of the IDEA. Research and best practices concerning children's development, including meaningful parent and family engagement and physical health and development, and then policies regarding the social, emotional, behavioral health of children, including policies to prevent the suspension and expulsion of children ages birth through age 5. And then the law also required that consumer education include information about resources and for developmental screenings for children. And so the rule also requires that in addition to just making this information available to parents and providers, providers must be given information about how to access the resources for developmental screenings through training and education. And then also parents must be, families must be given this information during their CCDF intake process. It's really critical that the information is targeted and gets to where it needs. I think that that's an important piece of that. And lead agencies should ensure that all providers are knowledgeable on how to access these resources to support developmental and behavioral screening and make appropriate referrals as needed to ensure that children receive services and supports as early as possible. Okay. All right. And then the last piece of the consumer education requirements is the consumer statement. Because it's important to provide targeted consumer education to parents receiving CCDF, which I've mentioned several times already, the rule requires that CCDF parents be provided with a consumer statement. And the statement must include general information about how subsidies are designed to promote equal access, how a parent can submit a complaint through the hotline, and how parents can contact local CCR&R agencies and other supports. Certain provider-specific information must also be included, such as the health and safety and licensing requirements met by the provider, the date of last inspection, and any voluntary quality standards met by the provider. As you can see, there's a lot of overlap between what's required on the consumer education website and what is required in the consumer statement. And we did that on purpose to try to not create a lot of burden for the state when we knew you were already going to be collecting a lot of information. And so states can certainly refer parents to the website if it includes all of the information that's required by the statement, the consumer statement. And a bit more about it, we did not expect you to create a whole new document, as I mentioned. Instead, you can point to the provider's profile on the website or print out the profile for a parent during the intake process. And one of the things we just want to point out is that if you do choose to provide the information electronically, you need to confirm that the parent has access to the internet or another means of reading it. And if they don't, provide them with some access on site or mail it to them. And also to make sure that the consumer statements are accessible by individuals with limited English proficiency and individuals with disabilities, which is in line with the requirements of the other consumer education component. And then quickly on consumer education policies that apply to tribes, all of the tribes are exempt from the consumer education website, regardless of the allotment that they've received. But the tribes that receive in the large and medium allocations, they're subject to the majority of the consumer education requirements, but the tribes with the smallest allocations are exempt from them, from the rest of the consumer ed. So we've gotten a lot of questions both at STAM and through the regions, and we've updated our FAQs very recently to cover more information based on the questions we got. So this goes over a few of those questions, but I'm going to only do a couple, and then you can look to our FAQs on the reauthorization website and keep an eye on that, because all the sections have included expanded pieces. So this first one we got a lot of questions about at STAM and recently, and it asks if the final rule requires monitoring and inspection reports to be posted within 90 days of an inspection. And no, it does not require that they be posted within 90 days. We just include the 90-day as a benchmark. We think it'd be most helpful to parents to have reports posted as quickly as possible, but we believe 90 days is reasonable considering the complexities related to the monitoring and inspection process and reports. Okay, so then what information, this is a question we've gotten a lot, but what information on serious injuries and fatalities must be reported at the aggregate level? So this is the annual information you must update on your website. And at the aggregate level, lead agencies must post the aggregate number of deaths, serious injuries, and instances of child abuse that occurred in child care settings each year for eligible providers. The information on deaths and serious injuries must be separately delineated by category of provider, such as centers, family child care homes, and licensing status, licensed or unlicensed, or license exempt, excuse me. And then the information should include the total number of children in care by provider category licensing status, the total number of deaths of children in care by provider category licensing status, and the total number of serious injuries in care by provider category licensing status. And then I think this is the last question I'll do. What information on serious injuries and fatalities must be reported at the provider level? So this is the other piece of this requirement. At the provider level, monitoring and inspection reports and summaries must prominently display information about health and safety violations, including fatalities and serious injuries that occurred at the child care provider. These monitoring and inspection reports and summaries must be posted on the state's consumer education website. And I think one of the reasons we got a lot of questions about this is because what we proposed in the NPRM was a little different. So I included that to clarify the difference. And the NPRM had proposed to require states to post provider-specific information on the number of serious injuries and deaths that occurred in the provider setting, but we did not include that in the final rule. So, as I said, the rest of the questions are on the website, and we also have some resources, but I think it's more important to get to the states. So first we have Carrie Phillips, who's a QRS program specialist in the Office of Child Care at the Utah Department of Workforce Services. Carrie, are you there?
Hi. I am here. Can you hear me?
Yes.
Okay, then we can go ahead and get started.
Excellent.
So I am Carrie Phillips, and I do work at the Office of Child Care. Our website is called Care About Child Care, and it's at careaboutchildcare.utah.gov. And this first screen you're seeing is the welcome screen. So when anybody goes to this website, this is what they'll see. And we're going to focus today on the parent part of the website because that is the consumer education. But I welcome all of you to go to our website whenever you can and just play around and see what's there on the other tabs also. So the parents can either click on the tab up at the top or in the parent box down at the bottom, and that will bring them to this site. So you can go to the next one down, to this site. And so parents here on this page in the green box, there's a lot of information. The top 10 resources at the top of the box includes the TANF and the SNAP and Medicaid and Baby Watch and early intervention and all those resources and links to those. We have background screening information. That's a document licensing prepared on how they conduct background screenings and what those offenses that will preclude somebody from being a child care provider. And so all that information is there. And then at the bottom, we pick the things that we highlight and that we feel are most important, and they can be changed anytime. So right now we have up a link to parenting classes, to the Help Me Grow for the free screenings for parents and providers can use those, and paying for childcare, so people who might need help paying for childcare. But as most of you probably realize, most of the parents that come here are looking for childcare, so we have the parent search button. And when a parent clicks on that search button, so if you can click on that, click next, they will get this page. And there's two types of searches that parents can do on Care About Childcare. So the top one, where they can put in a zip code or a county, that's what we refer to as a marketing search. So they can go search and find a provider that will meet their needs. The bottom part, where they want to look at an individual provider's profile, they can type in the name of a provider or the name of a program and then get linked right to that provider's profile and page. Also on this page, we have the link to file a complaint. If you'll see that, that's so a parent can. That goes directly to licensing's website, where they can file an online complaint. And we chose to put that on this page because sometimes people have complaints about child care providers who aren't in the system because they're providing illegal care or something like that. So once they search and click on something, so you can go to the next page. So let's say they're looking for child care. This is the page that comes up to search for care. And so they can register in our system, and so that our system will save their information if they want to come back at a later date. Or they can search just as a guest and anonymously. So they'll click the area they want to look for, the location. They have the option of doing by county, by zip code. They can even go more narrow than that when there's more than one city or area within that county or that zip code or the city. We also have the option for them to search within a radius. So if they clicked on the little radius button, then they can click for 1 mile, 5 miles, 10 miles within a certain address. So an address box pops up and they can search within a certain address. So people will use that if they want to find someplace close to home or close to work. Then they can click for a program that has openings for a child their age, or just look at all the programs within an area. If they click on the other search options, which I didn't do a screenshot of this just because for time purposes, but they can also narrow the search even more. Because if you just clicked on Salt Lake County, where now with the zip code there's 8, but in Salt Lake County there's like 498. And so you'd want to narrow that down a little bit. And so you can search center-based, home-based, schools they transport to, if they have a preschool program, if they care for a child with disabilities that their child might have. So there's lots of options like that. And I really would encourage all of you to go to our website and just play around and kind of see what's there and how you can search. So when they do a search, so if you click to the next slide, there's different information that comes up when they do a search. There's actually a list of providers, but the information they can get on each provider is a little bit different. So there's 3 examples here that I'm going to show you. So if you look, every provider, depending on their level of regulation or whatever, will have these ribbons of different colors. Every single provider in our system will have at least 2 of those ribbons, the pink one that's at the top and the link to the Department of Health Child Care licensing record. The other ones they can earn or they get attached to them, but database, it just kind of depends. So the ones with the bright pink ribbon at the top, as you can see, are fully licensed, eligible to participate in the quality indicators, which at this time is Utah's QRIS, or Quality Indicator System. The ones with the light pink, they're residential certificate holders and licensed exempt centers that qualify for CCDF funds, so they've met all those requirements with inspections and background checks, but they're not eligible to participate in the quality indicators because they're not fully licensed. And then those providers like family, friend, and neighbor providers and legally exempt programs, they get a dark pink tab, and those ones will only show up if you search by name. They don't show up in a marketing search at all, but it still gives those parents that access to as much information as we have on those providers. And so when somebody does a marketing search, yeah, we're going to go through each of those tabs that could show up on those names. So the first one, under general information, so it has the care type up there that says center licensed, On the website, if you hover over that, it gives a really brief description of what that entails, that they get 2 inspections every year, announced and unannounced, and they have background checks run by child care licensing, that kind of information. And all this other information is from the child care resource and referral offices, which I do need to say that our Care About Child Care website is embedded in the whole child care resource and referral system. We refer to our child care and resource and referral offices as Care About Child Care agencies. And so it is all kind of one thing, but it has your license, their capacity, their vacancies, where they transport to, their hours, just that basic information. I thought it was really cool that this one has the people that speak Russian at their child care. It also has a link for them to email them or to their website if they have a website that they can add that link on there. Okay, so the next ribbon is the Department of Health licensing record. 2 things could come up when they click on this. The top one, see that dark pink ribbon? Because that program's not required to be licensed by the state. They are legally license exempt, and it's just saying we don't have inspections. They don't have a licensing record because there's no inspections on them. And we have a link to the different care types and descriptions so parents will know all the different types of care that are available out there and understand. Most people on the marketing search do have a view licensing tab like is on the second one. And it will, if you click on that, so if we do the next page, it goes directly to licensing's website. So can you click the next slide? So this is Child Care Licensing's website. It goes directly to them, and they've been really, really great with the way that they've done it. They have all the announced and unannounced and complaint inspections for the last 5 years that are available for parents to look. And so it is, they tried to make it really clear and what the findings are and exactly what was going wrong. The bottom kind of got cut off a little bit, so because this one was the play structure had exposed concrete footings. So they know exactly what it was. If further down in the page, if you go to licensing, we'll describe what each of those inspections are and how often they happen. We've been very, very lucky that we could have that link right directly to licensing. And licensing also does all the inspections for any CCDF program that is receiving funding through our office. And so it's really nice to have them all in that one place. Okay, the next slide. Okay, this is the Care About Child Care Quality Indicators, which is our quality indicator system right now. And so providers, and this is all in, but it gives parents those lists of things that providers are doing above and beyond licensing requirements. There's also a link to what all the criteria that are available are and those kinds of things on this page. Okay, next slide. Okay, this is professional development is the next ribbon that's up. This page talks directly with Utah's training registry and the career ladder that is part of our workforce registry and training system. And so it has automatically any classes that any caregiver that is linked with that program has taken, what level they are on the career ladder, if they have endorsements, anything else, any information we have. We did not put names on here for privacy purposes, so that it just says what their role is in the program and what level of training they have. We don't put names up there also because providers ask that we not do that so that parents don't call up the program and say, I want this teacher for my child. So it kind of helps them in that way also. Okay, so the next slide. This is a ribbon for children with special needs where the provider has told us through the Care About Child Care agencies or through the website itself, they can do it directly on there, what they are willing to take care of. So they have experience training or willing to be trained in allergies, asthma, autism, developmental delays, whatever they have chosen to put up there. This has been very, very popular with parents, especially those parents who have children with special needs. They really like this element of our website. Okay, and then the last slide. This is the provider message and photos, and this is where the provider gets to put on there whatever they want to put on. We have a little disclaimer at the top because we don't follow up and make sure they're doing what they say they're doing, but it is a marketing kind of thing where they can talk about what's unique about their program. They can upload up to like 10 pictures that they can put on there for parents, and there's really a wide variety of what providers have chosen to put on here to help advertise their program. On the back end of this, we do have staff who will check and make sure it's all appropriate, and they also have to sign off that they have gotten written permission from parents if there's any pictures of children that are in there. And so that's, in a nutshell, really quick, what our consumer education part of our website is. So if anybody has any questions, I'd be happy to answer those, or we can turn it back over to you guys.
Great. Thank you so much, Carrie. And if you do have questions, please put them into the chat box, and hopefully we'll have some time for more to go over those. And now I'm going to turn it over to Deb Swenson-Klatt, Manager of Child Development Services in the Minnesota Department of Human Services.
Great. Hi, everyone. So it's such a pleasure to be on and highlighting Minnesota's efforts in this area. I'm going to just ensure that my screen is showing. Can you see the first slide of our PowerPoint? Okay.
I hear you clearly and see your PowerPoint.
Great. We are, again, so pleased to highlight Minnesota's work in this area. There's been a slew of partners in Minnesota that have made our consumer education system efforts happen, and I'm going to, like Carrie did for Utah, focus in on our consumer-friendly website with a few PowerPoint slides, and then I'm excited to actually demo our site live for you for a few minutes. There we go. So as is probably the case in so many states, our consumer-friendly website has been evolving over time, and it is now in the form of a single website called parentaware.org. It replaced NACRAWARE's online search tool in 2014, and we had the opportunity and the privilege to partner closely with, through a public-private partnership, and rolled out parentaware.org in tandem with our statewide rollout of our quality rating and improvement system, which is also called ParentAware. The website allows for parent searches of over 12,000 child care and early learning programs in Minnesota. And parents can search for these programs by location, quality rating, or other indicators, with translation online in the 3 languages most common in Minnesota, spoken by these communities: Spanish, Somali, and Hmong. Or for a limited English proficiency speaker, calling for more support is easily available. Parents can also find on parentaware.org other supports in the community, and these are aligned with the requirements of CCDF, and in some cases go beyond them, but certainly include supports for low-income families in the areas of health care, housing assistance, and again, many other resources. And similar to Utah, this is also a site where providers can find resources. They can, of course, find the same resources available to parents, but this is also a website, as you'll see in a few minutes, that supports provider participation in ParentAware, the ParentAware rating system. So there is a section of the website with that information, as well as a place for providers to inform our child care aware system of incorrect information about their program. We think we've made great strides in the areas of user-friendliness and accessibility with parentaware.org. And as I mentioned, the public-private partnership that helped launch it funded not only the development of the site with private dollars, but also, and really equally importantly, brought with it expert consultation on web design and marketing that I would say we did not have available within our state agency. It uses an easy to use search functionality that is familiar for anyone who searches on the web for just about anything. You'll see that in a few minutes. Again, it includes online translation of some of the content and then a toll-free number that connects parents who speak languages other than English with a language line interpreter services. There is, like Utah's site, a direct link to licensing monitoring reports. And since the site's launch in 2014, we've seen almost 200,000 visitors. On average, we see over 9,000 unduplicated users each month. What's been exciting during the time period that our public-private partnership was in place is that we had some really innovative advertising campaigns go on in Minnesota. This occurred during the last 5 years in the period of our Race to the Top grant. And so we could see interesting spikes and real spikes in use of the website when our private partner rolled out targeted radio and social media ads. I'm not sure if we're going to be able to continue to support that level of investment in marketing going forward, but it's important to know what works, and we'll have those great lessons learned from this period of partnership in our back pockets. So a little bit about how parentaware.org works on the back end. I know this is of interest to fellow states. This is an inside look at the back side of the website, and it really is bringing together or utilizing information from 3 different data systems that we work with in our department. There are interfaces built between these systems. The first is our licensing division's LIS data system that stores information on licensed child care programs and includes information like the license number and the status of the license, the legally licensed name, and other relevant pieces of data. There is a data transfer nightly from the licensing data system to Develop. Develop is Minnesota's quality improvement and registry tool. It is a data system, an online data system that is both our system for applying for and issuing our quality ratings to programs, and it is also our registry. So all of the information from LIS that's needed feeds into Develop, and then there is a nightly data transfer to NACRWare, which we are still using in Minnesota, even though we no longer use the NACRWare online search tool. So NACRWare is holding all of the information on all licensed providers in Minnesota, including important information that our Child Care Aware, our Child Care Resource and Referral System collects on providers. And that data allows us to ensure that on parentaware.org, families, consumers can search for many of the features of a program that they might want to carry out or search for beyond just location and rating status. So you'll see again in a minute when I demo the site some of that information. With the interfaces we have here, and very similar to Utah, on parentaware.org, the provider-specific pages link with one click to the DHS website with licensing monitoring reports. And importantly, we think the license status of a program is featured on parentaware.org's provider-specific pages and search lists such that a parent can easily see what the license status of a program is. And in situations, especially I think where there might be concerning and really significant licensing actions that have been taken, this nightly data transfer ensures that if, for instance, DHS's licensing division issues a temporary immediate suspension, one of the most serious licensing violations that literally shuts down a program because of serious health and safety violations, that status is going to appear the next, by the next day on parentaware.org. And per our Parent Aware rating policy, if that program had held a Parent Aware rating, that rating would immediately be revoked and would not, and the rating would not show on the provider specific page. So with just one more slide here to mention that we think we've got a great foundation for moving forward with meeting the remaining requirements in the CCDF final rule. We have met many of them with this existing site. A few key areas I've noted here that are ahead of us in coming months, but we feel very confident we'll be able to quickly move in these directions and meet the federal rule requirements, but also provide, importantly, parents with this full range of information. So right now, I'm going to move into a quick look at parentaware.org by showing you the homepage. So here we are on the site live, and you'll see, I'll just give you a quick tour, that we are highlighting some key messages about why look for quality childcare in Minnesota, and that this resource is an important source of information to help parents find not just any childcare or early ed setting, but one of high quality. So this homepage features those key messages and then quick links to some top some high priority information about what star ratings mean and how and about school readiness for children, and then information about and easy ways to move into finding helpful guides on more information. Some of those guides you can see here are result from the federal rule and the reauthorized law that has prompted us to post information in these easy-to-read guide formats on housing assistance, low-income support, and healthcare. At the bottom of each and every page on the site is this toll-free number, and this and the site is, as a whole, is really our Child Care Aware System's primary resource for supporting families in finding care. So I'm going to scroll back on up and click on one of the two primary sections of this site for parents. There's a Learn section and then this Search section. On the Learn section is again easy access to guides that a family or any visitor to this site can, of course, access. With that toll-free number at the bottom and a mention of the translation of the site's information into Spanish, Hmong, and Somali. And moving to the search, the other primary part of the website, I'll just demo for you a really quick search. You can see functionality similar to Utah's, searching by location or name. We also allow at this initial search page a search by program type. I'm going to search for a child care program or early learning setting near my workplace in St. Paul at 44 Lafayette Road and see what comes up. Results are loading, and you'll see here a list of options for me as a parent that are arrayed by first star rating and location, a New Horizon Academy Center, Mount Airy Head Start, which is rated a 4-star in our rating system, Dayton's Bluffs preschool site, also rated 4 stars, of course, and I'll just note is license exempt under our state licensing law. A corporate-based YWCA program at Ecolab in downtown St. Paul. And I'm just going to click on this family child care provider operated by Lu Fang and Pang Mua in St. Paul. Wonderfully, this provider is rated 4 star, and I'm interested in a family child care setting, so I'm going to click on their name and see the provider-specific web page for Lu Fang and Pang Mua that contains all of this provider-specific information, including quick links to the explanation of their star rating, their yearly schedule, hours, ages served, environment. Similar again to Utah, an opportunity to talk about in their own words their child care setting. And then finally, I'll just highlight very quickly this licensing information that's on each provider-specific web page. There's a quick, easy to comprehend statement about the license. This is an active license, and with one click, I can view the record held in our licensing division's data system on this provider and read this additional information. So I will stop there after that quick tour and turn it back over to you.
Thank you so much, Deb. And we're very close to running out of time, so we're going to actually not be able to do questions right now. But we did get several questions in the chat box, and if our state presenters are amenable, we can maybe send them to them and work on trying to get those responses out so that other people can hear them. So we will work on following up with Carrie and Deb. And so thank you again for joining us for this webinar on consumer education. And I hope you've enjoyed this one as well as the other two we did. And the other two are already on the website, and this one will be soon. Yeah, we're hoping actually even as soon as within the next week, and we will make sure that we send an email out to all of you, everyone who registered as well, and that you have the link and the access to that information. Yes, so thank you again, and have a great long weekend, I guess, long holiday weekend. Thanks.